In 1969, the door of a psychiatric hospital in America was knocked. The man standing there, exhausted and frightened, said he was hearing voices in his head, voices repeating words like empty and hollow. After a brief examination, he was hospitalized on the grounds that he was mentally ill. But as soon as the admission procedures were completed, the man said the voices had disappeared completely, and he felt much better. The staff did not take this seriously. No one recovers that fast, they thought, so they kept him there, even though, in reality, they were holding someone who had no mental illness at all, for 3 full weeks, giving him medication every single day. So, how do we know he wasn't actually ill? Because that man was David Rosenhan, a psychology professor at Stanford University. He was conducting an experiment, and he had trained 7 other people to do exactly what he did. 8 fake patients in total. Each of them went to different psychiatric hospitals across the United States. They all complained about hearing voices, and once admitted, they immediately began acting completely normal again. Their mission was to observe how professionals interpreted their behavior. These 8 volunteers entered and exited 12 hospitals. The shortest stay was 7 days. The longest lasted 52 days. Despite showing no symptoms, despite repeatedly denying that they were ill, they were kept inside. And these hospitals were not poorly run institutions. Some were major city hospitals, and one was among the most expensive private psychiatric hospitals in the country. 7 of the 8 fake patients were diagnosed with schizophrenia. The remaining one was labeled manic depressive, what we now call bipolar disorder. Not a single expert recognized even one of them as fake, but the real patients did. Out of 180 genuine patients, 35 openly said these newcomers were pretending, or that they were undercover inspectors. The 8 fake patients stayed a combined total of 129 days. During that period, they were given over 2,100 doses of medication, antidepressants, antipsychotics, mood stabilizers, and because they were pretending, they secretly flushed all of them down the toilet. No staff member ever noticed. They also observed shocking mistreatment. Orderlies cursing at patients, even hitting them when they thought no one was watching. Basic care was nearly non-existent. The total time the fake patients received from professionals averaged only 7 minutes per day, and most of that was not even individual treatment. When the results were published in Science in 1973, the field exploded. Many rejected the findings. Some accused Rosenhan of exaggeration, or even dishonesty. But one research hospital challenged him. They claimed they could confidently identify any fake patients he sent during the next 3 months. Rosenhan accepted that. 3 months later, the hospital proudly announced that out of 193 incoming patients, 41 were definitely fake, and 42 others were suspicious. Rosenhan's response became legendary. "I didn't send you a single fake patient." The entire field went into shock. Were psychology and psychiatry truly this blind? This experiment raises a deeper issue. Where does normal end? Where does abnormal begin? In medicine, some things are easy to quantify. Human height, for example, follows a smooth bell curve. Most people fall within 1 or 2 standard deviations of the average. Only the extreme outliers, the bottom 0.3% and the top 0.3%, are considered abnormal. But the mind does not obey such neat distributions. You cannot graph sadness the way you can graph height. You cannot measure peace, anxiety, grief, or despair with a ruler. And so the boundary between sad and depressed, between eccentric and mentally ill, becomes blurry. This is the heart of the problem the Rosenhan experiment exposed. But psychology and psychiatry have advanced dramatically since the 1960s. Today, mental disorders are defined using systems like the DSM and the ICD. Large catalogs that list symptoms, subtypes, and diagnostic criteria. Standardization exists for a reason, to prevent people from diagnosing however they want. Patients should receive consistent care, no matter which clinic they enter. But medicine is not only a science, it is also an art. Machines like MRI scanners can show the brain, but they cannot interpret a patient's memories, traumas, fears, or emotional patterns. A physician sometimes must make decisions with incomplete information, while a patient's life hangs in the balance. For centuries, mental illness was treated with cruelty. People were chained, tortured, drained of blood, electroshocked without consent. Many were hanged or burned, accused of witchcraft or possession. Even today, Hollywood loves depicting mental illness as an irreversible curse, something you can never escape. And in Rosenhan's time, none of the fake patients were discharged as recovered. They were labeled schizophrenia in remission, a deeply unsettling tag that implied the illness would haunt them forever. But since then, the landscape has changed. The medical model of psychiatry demonstrated that many mental illnesses have biological causes and can be medically treated, sometimes even cured. This breakthrough helped reveal that conditions once seen as madness were actually the result of advanced syphilis and fully treatable. Later, the biopsychosocial model transformed the field. It argued that psychological experiences are influenced by biological factors. Life experiences, trauma, stress, social expectations, anthropological norms, all interacting together. This holistic perspective allowed treatment to become more personal, more accurate, and far more effective. Today, the numbers are enormous. 264 million people suffer from depression, 45 million from bipolar disorder, 50 million from dementia, 20 million from schizophrenia or related psychotic disorders. And a vast number of these people are living better lives thanks to treatments built on decades of scientific progress. This is why statements like "this illness isn't real," or "this medication doesn't work," or "therapy is useless," are not merely wrong. They actively harm people. They place barriers between patients and the help they desperately need. Those who dismiss psychology or psychiatry as not real sciences have never provided a better alternative, because no such alternative exists. If a more effective method existed, it would already be part of science. Everything outside this framework has been pseudoscientific nonsense. None of this means psychology or psychiatry are perfect. They have flaws. They have blind spots. They have growing pains, just like every scientific field. But science is not a moment. Science is a process, a long, slow, sometimes painful path toward clearer understanding. Every discipline moves along its own track, some fast, some slow, but all moving toward deeper truth. And that is the real lesson of the Rosenhan Experiment. It revealed weaknesses not to destroy the field, but to force it, to improve. And it did improve, substantially. Today, more lives are being saved, more suffering is being eased, and more people are being understood than at any other point in human history. The journey continues. The questions deepen, and with every step, science brings us closer to the truth. See you in the next video.